Well, hey everyone, you were never told that sexual side effects would be the result of taking an antidepressant, even after you stop. We are your whistleblowing shrinks, Dr. Terrelyn and therapist Jen, and you have landed yourself on the Gaslit Truth Podcast. Today we have a very special guest that is on the show, Cael Meekum. Cael, welcome to the show.
Thank you.
Yeah, let's tell everybody a little bit about you.
Hold on. Wait.
oh.
Before we get started, I wanted to do the little disclaimer.
Oh, all right.
So,
Dr.
we are
Keith,
going to be
bring it
talking
in.
about some adult sexual things, using body parts and language and things like that. So
Big words.
big words. If that's not your jam, then this isn't your episode. But if it is, please stay here because I think it's stuff you need to hear.
I think this is the let's talk about sex, baby. Let's talk about you and me. We'll put that in a
Yes.
deliverable for you.
Yes.
Okay, everybody. So let's talk about who Cael is here with us. Cael's here to share his experience with psychiatric medication harm and to speak out about post-SSRI sexual dysfunction, which is a condition that's extremely devastating. It's life-altering, and it's still widely unacknowledged by the medical community. When Cael was 19, he sought help for anxiety, and what followed of that was years of being prescribed powerful medications without proper warnings, informed consent, or follow-up. So he is here to share his story to raise awareness of PSSD and to push for real accountability from the pharmaceutical industries, the medical system, and the institutions that ignore the lasting damage that these drugs cause people.
Yep.
So welcome to the show, Cael.
Yeah, thank you.
So how'd you get here? Tell us a little bit about how you connected and are sitting here in front of us.
Yeah, so through the PSSD network, they contacted me and I volunteered to be willing to speak about it. So
that's really courageous because I just want to point out, you guys, Cael's only 22 years old. So he's talking about this stuff in the heat of a college experience, which to me is like the heightened peak of your sexuality is during college. And so I would like to start by just sharing your story, if you wouldn't mind, just starting from the beginning of when you were first prescribed.
Yeah. So back when I was 19, I had experienced some anxiety after moving out of my home. I was kind of living on my own for the first time. And so what comes with that is kind of like, a sense of anxiety, right? And I started just feeling overwhelmed, just like having like anxiety attacks and just not I couldn't figure out what the issue was. I kind of knew, but I was like, I might need some help. Like I'd been working out, like trying to like relieve some stress, and it just wasn't getting any better for me. So I went to my doctor, my childhood, pediatrician, and I told him kind of I was experiencing some anxiety. I had heard from my sister of some medication that might help with anxiety, but I kind of just told him what I was experiencing, and he was like, "Well, there's this medication that works really well for helping with anxiety, and it's genuinely well tolerated." And he told me about Lexapro. And so he started me out on Lexapro, and he said, like, just take it and your anxiety will start getting better. It'll improve. It might take a while, but it will improve. And I filled the prescription. And then from there, I remember the first day I took it, I felt like euphoric. Like I felt like super elated. Like I felt really good. And I was like,
you're manic, by the way.
yeah,
That was mania. Yeah.
yeah. I was like, I feel really good. I was like, I'm so glad. I remember like calling my mom and I was like, I feel so good. Like I went to my doctor and I started some medication and I just like, this is the best I've ever felt in a long time. And I just kept taking it. And over the following weeks, like I noticed like changes in my behavior. Like I just wanted to be alone. Like I just wanted to be isolated. And I started feeling down, like I was depressed, even though I've had moments of sadness, but like never like depressed or like I couldn't like really function, and I wasn't told like any side effects. Like he didn't tell me anything of what to expect from taking Lexapro. And what came from that was just like suicidal thoughts and like just feeling down. And prior to Lexapro, I'd never been suicidal ever in my life. And so I was like, what is going on? I was like, I couldn't figure out what the issue was because I never knew it could be from the medication. I was like, maybe I'm just stressed out, living on my own for the first time. That's causing me to feel this way. And so I just kept taking it, and it just kept getting worse. And so I texted my stepmom. She's a pediatric nurse practitioner, and she told me to contact my doctor and kind of tell him the side effects I was experiencing, what I told her. And he told me that I was experiencing symptoms of depression, and that he needed to up the dose of Lexapro to the maximum dosage of 20 milligrams, and that he was going to be adding Effexor. I think it was at like 75 milligrams. And so I started on, Effexor, and I started getting more side effects, like just like sweating excessively. And then the sexual side effects kind of started becoming more prominent. I started noticing them a lot more. And then I called the doctor again. I met with him, and I told him kind of like the sexual side effects that I was experiencing, like delayed orgasm, feeling like just like feeling spaced out. And he told me like that, like that's just expected to be with the medication. Like sexual side effects are to be expected on an antidepressant. And so I was like, okay, that's fine, I guess, for now. Like while I'm taking the medication, I can deal with it. It's tolerable. So I just kept taking the medicine. I thought it was my like anxiety and depression that he was telling me about that was making me feel this way, and then just the sexual side effects were from the medication that I found out. So then I took it for another year and a half, and it just never got better. Things started getting worse, and I just decided to stop it on my own, just cold turkey, both of them, because my friends were telling me, they're like, Cael, like you're acting really different. Like you just seem different, like something's wrong, And I was like, yeah, like they started telling me like kind of the different shifts in my personality and like just how I was acting. So I decided just to stop it. And I was fine for a while, but I still had like ideations and wasn't feeling very well. And I didn't know anything about withdrawal. I didn't know you could withdraw from antidepressants. And so, but I didn't really experience any severe like withdrawal symptoms that a lot of people report at that time. And so I waited a couple more months being off the medication. And then I went to a therapist at my college, and I told the therapist what I was experiencing, and they told me that I need to get on a medication, that it's obvious that I need help. So I went to a psychiatrist at a local hospital, and I told him everything that had happened, and he said I just hadn't tried the right antidepressant, that there was another antidepressant that was well tolerated, and it's called Zoloft. And he said, we'll start you at 25 milligrams, but the therapeutic dose is 50. So take it for a few weeks at 25, and then up yourself to 50 milligrams, and then we'll just stay from there and see how things go. So I started taking it, and the same things with Lexapro and Effexor happened. I just tolerated it as long as I could, and then I just couldn't take it anymore. Like he just wasn't listening to me. Like he wouldn't guide me on getting off the medication. And so I stopped that one cold turkey as well. And I felt good. Like I felt on the antidepressants, I felt very emotionally numb, like just like more blunted. Like I wasn't as reactive to like my emotions. And I just was sick of feeling that way because I knew it was from the medication. So I just stopped Zoloft, and within a few weeks, I started like getting more down, like feeling very like agitated. And I found out like it's symptoms of like akathisia, like where you can't just like sit still, like you got to move all the time. And then also insomnia, like I couldn't sleep for a long time, just like more than 3 hours a night. And
Can I stop? I want to stop the history here for a second, because you had said that you didn't know any of this stuff before, and now you're talking very much like you know a lot of it. Where was that moment for you that you were like, this is wrong, something's up with me, and I need to search somewhere for a different answer? Like, when did that start? Because now you've got all the language, right? You have all the experiential language that you need to describe your experience. Where did that come in for you? Because nobody was really helping you find it. They're all like,
no. Yeah,
mhm.
it was probably within like the last year. So after stopping Zoloft and then experiencing withdrawal, I kept going to doctors, trying to figure out what was going on. I got put on another antidepressant, and then an antipsychotic.
Oh my
And
God.
I stopped those after a few weeks. I just had terrible side effects. Like my hair started falling out, like thinning, and just lots of side effects. So I stopped. I was off it for probably another 4 months. Just couldn't sleep. And then my mom, well, my stepmom and my dad were like, "You're too anxious. Like this is out of control." And I was like, "I'm experiencing withdrawal, like from the medication," and they wouldn't listen to me. And my uncle's a nurse psychiatrist, and he had me take something called a gene site test. So it basically takes a swab from your mouth and it sees what genes, like if you're a good metabolizer of certain antidepressants. So the test results came back and they said Cymbalta was a perfect match for me, that I would metabolize it very well and that it would be well tolerated. So I told him about the side effects I'd experienced. And so he was like, "It seems like you're sensitive. So we'll start you on a low dose." So I started on 20 milligrams of Cymbalta. And within, I would say, about a day or two, like I knew something was wrong. Like I I just felt numb, like I had on other antidepressants, but like I couldn't even feel sad. Like I couldn't feel any emotions. And then I also noticed like my genitals had become numb. Like even touching them, I couldn't feel it. And like I couldn't really get an erection. I couldn't feel orgasms, and I I didn't know what was going on. I just thought like maybe this is, like, I knew it was from the medication, but I was like, I experienced sexual dysfunction from the medication before, and so I was like, this is probably, it's just a different antidepressant, so it's a different side effect, like maybe this is just part of it, right? So I took that one for probably 2 months, and then I got off it again, and then things just, it never got better. Like I had erectile dysfunction, genital numbness, like emotional blunting, um, just lots of side effects, and it just, nothing ever changed. I told my mom, my stepmom and my dad about it, and they just wouldn't listen to me, wouldn't listen to what I had to say. And so then I just kind of researched on my own, and I found out about like PSSD. But to be diagnosed with PSSD by like the guidelines they've set, you have to be off medication for 3 months and still be experiencing side effects. So it had been about like I think 6 or 7 months, and I was like, I'm still experiencing these side effects. And that's when I knew like I've been lied to. Like these medications aren't as safe as they say. Like I was never told this was possible. So that's
Then
kind of what
you're mad. Yeah, then
happened.
you get mad and you get
Mhm.
curious
Yeah.
and you want to shout it from the rooftops,
Yeah.
right?
I want to tell people about it so that it
Yeah.
doesn't happen to others.
Yeah.
Yes.
Yeah. So within this, Cael, what's interesting is it's hard to know. And I think a lot of our listeners that have been a victim of polypharmacy.
Yeah.
Okay. I mean, you're talking about Lexapro and then Effexor and then Zoloft and then Cymbalta. I think I missed one too. There was another
There's
one.
Prestige. I was also on
Prestige.
Prestige.
Yes.
Prestige, yeah,
Okay.
Yeah.
there's
Good.
an
So there. Yep.
antipsychotic.
And an
So
antipsychotic called quetiapine. Yeah.
okay.
Yeah.
Yes. Okay.
Mm.
Okay. So there's 6 different medications here, right?
Yeah.
And the
Mhm.
hard part of this is there is a thing called protracted withdrawal. There is
Yeah.
a thing when it comes
Mhm.
to PSSD, which we're going to talk a little bit about, which is this can be coming. You don't know what came first, like with chicken or the egg, in terms of all these medications. You could still be experiencing something from Lexapro, which was the very first drug, or Effexor, which was the second drug,
Yeah.
which months or years later then pops as a sexual side effect, or it could be coming from the antipsychotic, right? Like, so when you the whole like diagnosable criteria of how you have to be off of a psychiatric medication for 3 months to be able to label somebody with this, clearly I have an opinion on that because I think it's kind of a bunch of bullshit. Because this could have been part of that journey that started with that first medication, which you
Good
were
call.
experiencing.
Yeah, that's
Yeah.
a really good call, Jen.
You know
Yeah.
what I mean? Like, so it's kind of
Mhm.
one of those things where every time I hear something like that, like if we look at your whole picture,
Mhm.
that 3 months is arbitrary. when you look at the trajectory of the meds and how long you were on them, right? So I think it's worth pointing that out for people that are listening, because we get so stuck, I think, on the, well, I've got to experience this for 3 months since I've been off the med.
Yeah.
I think a
Off
lot of people
all meds.
off of these
This is
meds,
all
right?
meds, yeah.
Yeah.
Mhm.
When in reality, what we know is that protracted symptomology comes up for people even a year later after being off of med, right?
Yeah.
So I think that's an important space to just sit in for a sec. But the other thing I was hoping you could do, Kale, is can you tell our listeners, because you are, I would say, you are an expert
Yeah.
in PSSD. Okay.
Mhm.
You are a lived expert within this. And you also you are sitting in front of us as part of a network that educates the world on this, right? There are support groups on this. So could you give our listeners a little bit of information on what PSSD is? And I know you've said a few symptoms that
Yeah.
you've experienced, but in general, what is this? What does it stand for, and how does it impact people?
So yeah, PSSD stands for Post-SSRI Sexual Dysfunction. It can also apply to other antidepressants such as SNRIs. Um, and it basically is just they don't know the exact cause, but it's just prolonged sexual dysfunction and like emotional numbness and a bunch of other side effects after you stop the medication.
Mm-hmm.
Yeah.
So it's not just sexual side
No,
effects.
no,
It's
not at all.
also the emotional
Yeah.
numbing out of
Hmm.
self,
Yeah.
right?
Yeah.
Which arguably I would say the majority of people experience.
Yeah.
Yes.
I did for sure.
Yeah.
I never would have put that into the category of a sexual dysfunction, but it is sure a pleasure dysfunction.
Yeah.
Right. And so
Hmm.
I've said this before about people, like, we are programmed for pleasure. And if we take pleasure away in all facets of then what is it? Then
Yeah.
what is this life that we're in?
Exactly. Exactly. Yeah.
And you were, I keep harping on this. I'm like, you were in the throes of your collegiate experience,
Yes.
which, if anyone goes to college, that's where you have a lot of sexual experiences and a lot of
Mhm.
sexual desires and all of that. So when I think of a young man like that in college, like, what was that part emotionally like for you? Can you explain that? Like, what did it mean? It wasn't just my junk isn't working anymore. It's
Yeah.
got to be a little deeper than that.
Oh.
Like, what was
Oh, it
that
is
like for
deeper.
you? Yeah.
Yeah. Just immense loss. Like, there's no treatment. They don't know the exact cause. Just like to lose your sexuality, is just very sad, especially in college, right? Like you want to date, you want to meet with people, like you want to have like sexual experiences. And it's just
Mhm.
very sad to not be able to experience things the same as other people. And just to touch on like the emotional numbing, like it goes beyond just like my emotions are blunted. Like it's like I don't feel like love for like my family or like my parents or like my siblings.
Yes.
Like I could
Mhm.
go the rest of my life without talking to any of them and I wouldn't feel anything. So it's just like it's yeah, a very big loss. Yeah.
Like a wall. Like, I
Yeah.
experience like it's a wall between
Hmm.
you and everyone else.
Yeah.
You know they're there. You know
Hmm.
that you love them, but
Yes.
you can't get past that
No.
wall to
Yeah.
actually connect with that.
Hmm.
And we're also talking about a time of your life, developmentally, with social interactions, right? Like, how to connect with people socially,
Yeah.
and this was only a few years ago, right? Well, you're still going through it right now,
Yeah.
correct? Yes.
Hmm.
But this started only a couple of years ago.
Hmm.
So, um, that is like your social cues, your how you relate to other people. There's an emotional bond, an emotional piece of this in stages of development that I think were probably also lost, or
Yeah.
you could consider being lost. So you're making up for that as you age. Yeah, so how else did that impact your college experience, socially, do you think?
I can't connect with people very well anymore. I can still be friends with people, obviously, but it's not the same. Like the connection with others socially just is very changed.
Yeah.
And then just yeah, just feeling very disconnected with people. Like, I've heard this said before, where it's just like you almost don't feel human because it's like you lose your sexuality, lose your ability to feel emotions.
Yep.
So it's like you lose a fundamental part of being a human, you know?
Yeah.
Yes.
Yes. Um, oh gosh, there was something it was right on the tip of my tongue that I was going to ask you about. And I'll get there in a second. In a second. You did send us a link to I think oh no, I don't want to move away. Oh, from Prozac. It was a Prozac link.
Yes.
And you said it's PSSD is buried in
Mhm.
the
It is.
insert, which
Yep.
it is, because
Yep.
I'm going through it and I'm like,
Yep.
where is this? Where it's
Yep.
like lists everything else, and then
Mhm.
suddenly at the very bottom it lists sexual dysfunction, and I want to read it because something hit me here.
Yep.
Um, although changes in sexual desire, sexual performance, and sexual satisfaction often occur as a manifestation of a psychiatric disorder, they may also be a consequence of pharmacologic treatment. In particular, some evidence suggests that SSRI can cause such untoward I can't even read this. Untoward sexual experiences. Reliable estimates of the incidence and severity of the experiences involving sexual desire, performance, and satisfaction are difficult to obtain. However, in part because patients and physicians may be reluctant to discuss them. And that part and the
Yes.
very beginning part to me are the two that stood out. The reluctance to, he's gone. The reluctance to discuss sexuality in a therapist's office or in a prescriber's office is something that I find fascinating, because you should be talking about sex and sexuality, especially when you're someone who is 19 to
Mhm.
22 years old. I would think that that would be part of the conversation altogether.
Well, and what you just read, Terry, I think that what stands out to me, the first half of what you read, the former of that, was almost blaming
Mhm.
the idea that these sexual side effects can happen. It's the psychology of the person. It's not that the distress from this is coming from the psychiatric medication. The distress itself is coming from the actual mental health of the
Right.
individual that is taking the psychiatric medication. Now, I
Right.
know then it then goes on and gives the other half of it, but I think that that's what a lot of people experience. Kale, in your case, it's interesting because you actually had a provider. In your case, you actually had a provider who said to you, yeah, well, psychiatric medication, like this is a super common side effect. I don't hear that a lot. I don't hear people a lot say, well, my provider is the one that said, this is really common. Yeah, you're taking Effexor, right? And that's a super common thing. What we hear a lot more is providers who can't seem to connect the dots within the idea that the sexual side effects that you're having are coming from the psychiatric medication. So that insert right there tells you a lot about their stance on this, and how most of the time it's the provider going, oh, this is part of your mental health. This is
Mhm.
a psychological issue that you have. Um, Something I pulled up here, which I thought was a little bit interesting, is that there was a study that came out not too long ago that PubMed put out, because I was reading about this. And the hard part about this is now that there's more awareness of it, research is actually starting to be done on this. Okay.
Mhm.
But the numbers, when you look up the numbers of people that are struggling with PSSD, okay, part of what you just said, Terry, at the end of that insert is it also has partially to do with the connection being made that the sexual side effects are coming from the antidepressant, and people have to report that. Like, these are things that have to be reported. So this
Mhm.
this study that I found, was one that was a 19-year-old retrospective cohort analysis that was done, which requires that people reported this and that
Mhm.
this was actually reported out to drug companies, right? And so they used a huge computerized database. This was actually out of Israel. Okay, it was a study that was done in a different country. But what they came up with is that one out of about every 216 patients within this cohort analysis that they did, not only suffered with PSSD, but suffered with irreversible effects. So that have not gotten better for them. 1 out of every 216.
That's it?
Yes. And this was going back about 19 years. Now, again, when I read this, one, I'm like, well, that's horrific, right? So out of every 200 people, I mean, of the millions of people that are taking antidepressants, right? You think about that.
Well, I
1 out of
suppose.
every 200 of you is going to probably struggle with this, and it's
I think it's
irreversible.
more.
Yeah.
I
But
think
it's
it's more.
irreversible, right? So in
Yeah.
this case, it was specifically like ED that's irreversible. That has
Yeah.
not the sexual side effects have been there the entire time and have never gotten better. So that was alarming to me. It's probably more than that, right? Because we're talking about
Mhm.
you have to report this, right?
Yeah.
But that's alarming to me, even at that number. And we know that number's low,
Yeah.
right?
And it could be a lot higher just due to the fact that a lot of like prescribers or doctors like will just say it's the underlying condition. Like it's
Mhm.
just the
Right.
depression or the anxiety that's causing
Yes.
these symptoms.
Yes.
Mhm.
Yeah. It's the psychological piece of it that's
Hmm.
creating these responses that are happening.
And
Yeah.
I still go back to your story. You started off with anxiety because you left your home at 19, which to
Hmm.
me, there's a level of that I would expect,
Yeah.
right? At
Yeah.
19, even if it were just going to college, but it sounded like you went off and lived by yourself somewhere, whatever.
Hmm.
But that there would be a level of anxiety and
Yeah.
trepidation and all of that. Like to me, that would be like a typical response to a 19-year-old going out, forging out on
Hmm.
their own, right?
Yep.
But you started with anxiety and then suddenly now you have suicidal depression.
Yeah.
And this is so common to so many people, which is why I think those diagnoses often are diagnosed together, right? You start with one, you end up with the other, and usually you end up with
Hmm.
another because you get medicated, and that
Yep.
medication now causes something else. And you had also mentioned, and I kind of blurted out because I'm feeling kind of blurty today, that you took it, and within a couple of days, you were like euphoric,
Hmm.
right? That is like this induced mania that you probably had that a lot of people experience. And in that time, just like with you, it was this, wow, this is an amazing
Hmm.
thing. I've never felt like this
Yeah.
before. When really that was mania induced by the medication, which then, by the way, people will say, oh, maybe you are bipolar, right?
Yep.
So
Yep.
yeah, did you have
Yep.
that too? Did they question bipolar with you?
Not at that time, but in a different talking with a different doctor, they
Yeah.
did mention
Mm,
that. Yeah.
yeah.
Yeah, well, and having an antipsychotic thrown into the mix, what
That's
is the
where did that
symptomology
happen?
that you were experiencing that led to okay.
Yeah, I could
He's
tell
like, I
you.
don't even
Get us
know. I
started
have
Yeah.
no
here
idea at this
first.
point.
No.
Yeah.
Yeah. So when I wasn't sleeping for so long,
Oh.
I was just desperate. I was like, I need
Oh.
help, you know?
Yeah.
So that's when I went to an Instacare and I met with a doctor, and she didn't even tell me, but she was like, yeah, this medication like will help you sleep.
Instacare.
And
So this is
What
this is
is
yeah,
like an
Instacare?
urgent care
yeah,
kind of drive
urgent
through.
care.
You just get a
Yeah.
doctor
Hmm.
quick if you've got an issue.
Yeah. Uh-huh.
What? You got an antipsychotic
Yep.
at a
Yep.
walk-in clinic,
Yep. Yep.
Instacare, like
Uh-huh. Yeah,
Walmart?
so
Like what?
yeah. I didn't even know that it was an antipsychotic until I Googled it. And then I was like, what am I
What?
gonna be taking, you know? But I was so desperate to sleep that I was
Yeah.
willing to take
Sure.
it, you know?
Oh,
Because I
sure.
didn't know about like all of this, you know, until I started looking into it myself, you know.
So how'd you come across the PSSD network in terms of getting yourself involved within this? Where did that
Just
come into the story?
just Googling like I try to remember like just sexual dysfunction from like Cymbalta and like just looking up like even after you stop the medication like symptoms of like that I was experiencing, and even a little bit of with AI like asking
Oh,
questions,
nice. AI. Yeah.
and
Mhm.
Yeah.
and it like told me about like PSSD, and then like I started googling like PSSD, and then I saw the network, and then I reached out to them, and then they connected me with the group. So
Yeah.
Wow, that's pretty amazing.
mhm.
I do wanna kinda circle back to the gene site
Yes,
conversation that you
Mhm.
yep.
had,
Oh,
because
people get pissed about this.
they do, because the exact
My
reason.
clients get so mad
Oh, I
with
know,
this
because
when I'm
it's
like, you need to be very cautious with all of that." And they get really
Mhm.
mad. People get
Oh, yeah,
so mad.
because this is gonna be the slam dunk of prescribing,
Yep.
right? So if we only know
Yeah.
what your genes will tolerate, then you can be prescribed the thing that will be matched with your genes. That
Mhm.
is not even a scientific thing right now. Like, it is so infant in its infancy but people look at it like this is what is supposed to help me. But more often than not, I hear stories like yours that, well, all these are in the green. Like if you guys don't know, there's like a green column, which is like go, a yellow, which is like caution, and a red is stay away, right?
Yeah.
And so it has to do with how your body methylates certain things. But anyway, it's a whole different show. But if it's in the green column, it's supposed to be good for you.
Yep.
It's supposed to work for you.
You can
It's supposed to
metabolize
be-
it. It can go through the body without there being adverse side effects.
Yep.
Yes.
Right.
Yes.
And so we're led into this false narrative that is going to be the gold star for you. And for yours, it was Cymbalta, right?
Yep.
Which Cymbalta is horrible. Like it's terrible. It's bad.
Yeah.
There's whole Facebook groups. I think there's almost 50,000 people in this one group called Cymbalta Hurts Worse. And that group is just filled with 50,000 suffering people on Cymbalta. And so right when you said that, I was like, whoa. So this is the cautionary tale about GeneSight as well. So the relative that told you like this is the slam dunk, like I hope they know that it wasn't. Were you able to tell them like this? No.
No.
It's okay. We'll tell them. Send them the episode.
Well, if they ever find us, cat's out of the bag, Cael. Like,
Truth's out.
Truth is out. Yes. So there's that part of it. And then it was also interesting when you started with Lexapro as being, the easiest to handle medication. Like the way that it was sold to you is important, right? Because it was sold to you like it's well tolerated. Like nobody has anything bad that happens to them on this medication. Lexapro is hardcore. Like, well, they all are hardcore. I hate it when we have this like, differentiation of worse, better, what's, less risky, more safe, blah, blah. They all come with risk and they all come with iatrogenic harm right attached to them. I wonder if somebody would have said that to you off the start. What do you think it would have been different for you if they said, hey, like every medication that we're going to prescribe you will come with a side effect of harm. We don't know what that side effect is going to be, but here's a strong list for you to consider. And as a 19-year-old, it might take your sexuality away.
Yeah, I would not have taken them at all. Yeah.
Yes.
At all.
Yes. Just during that part of your life.
Yeah.
Period. Right. And so I typically say, like, as a woman, like I was really dismissed when it came to sexual dysfunction. I was really dismissed about it. My husband was villainized for wanting it, and I was dismissed for it even happening. Okay. Like he should have been more kind and considerate with me and put his own sexual desires on the table, even though I had none. Like I had zero. I was numbed out. And that because a lot of this for Jen and I too is kind of going back in our history, same as you, like going back and connecting the dots and the pieces. And so knowing that the show was coming up, I was starting to think about it. And there were definite things that happened to me, or I should say didn't happen to me, even post taking the SSRI, which I chalked up to being a mom, being stressed out, being all these things. And now I know that it was still a continuation, and I probably could have been diagnosed with PSSD for the post use of the SSRI. But it's interesting to me because it doesn't seem like the message you got as a young male was all that different than the message that I got as a woman and, a middle-aged woman. The message of nothing to see here, kind of, right? Like the message of your mental health is more important than your sexual health at this point, right? That's the message that I got. It kind of sounds like you had a similar message. It also the message of this isn't happening, just being purely gaslit by your therapist. This isn't even a thing. Don't worry about it. Yes. And so I also wonder, as a 19-year-old who sought help, it sounds like you have a lot of prescribers in your family. So the idea of mental health equals a prescription seems pretty maybe profound, but also you're of the generation that mental health care and treatment and medication is like the way to go. Your generation is very hooked into medications, And do you think that that may have played a part for you thinking like, well, I've heard about all this stuff and it's good.
Hmm.
Therefore, this is what I need. Do you feel like that type of messaging kind of got to you too?
Yeah, like even in high school, we're told like if like you need to reach out for help. Like if you're suffering,
Mhm.
like reach out for help, right? And so like reaching out for help is going to your doctor and like asking for help, you know?
Mhm.
So
Mm-hmm.
I was like the medication's like approved, like it's safe, you know? And then here I
Mm-hmm.
am,
Yeah.
right?
Yeah.
Yeah.
Yeah. So if we fast forward like to present day right now, Kale,
Hmm.
you started to touch on this before. Terry and I have talked about this. We did an episode way back on
Yeah.
this about the impacts of psychiatric medications on
Hmm.
marriages. Okay. So if you put yourself in present day right now, can you tell us a little bit more about, are you able to have a relationship, a sexual relationship at all? Are you able to connect with people in a very intimate way? And I know you're talking about your family and you said
Yeah.
that there's a disconnect there,
Hmm.
but in terms of like an intimate relationship with someone, what does that even look like for you, Kale?
Yeah, like it's just very hard. Like I've tried. Like I've tried to go on like dates and like connect with people, but it's just I can't do it. Like it's like I have to lie, like I have to fake like being fine, you know, all the time and like just even like sexually I got prescribed like erectile dysfunction medication, you know, like Cialis to try to help like if I was going to have like a sexual encounter, like I could use it. But it was more just like yeah, it's very hard. Like it's not possible, you know. And even that, like it didn't help. It only helped erection, right? It didn't help anything else.
Right.
So
No
it wasn't even
connection.
worth
Yeah.
it.
Yeah.
Yeah.
Mm-hmm.
So just not possible. Like if you find the right person, I think it is. But
Okay.
it's a lot of baggage, I would say, you know, to like tell somebody about, right?
Right.
So
Well, and hard to describe too,
yeah.
right? Like unless
Mm-hmm.
someone understands this or has been
Yes.
through this, they might see you as cold or
Mm-hmm.
kind of shallow, or it's just kind of off-putting that you can't make that genuine kind of connection with somebody, or even to be able to be in a space to, like sexually be able to physically be able to do the things that you want to be able to do, and having to then try to explain that to someone, like,
Yeah. Not possible unless it's like the perfect person, you know. It's just
yeah,
very hard. Yeah.
Yeah. You know, it sounds like though that you have hope for the future. To find the right perfect person. Blah, I can't even say that. You know, because you say like if I find the right person, maybe if I find. So I want to point that out as a measure of like you are hopeful. Like there might be a little glimmer of hope in there. So
Yeah,
please don't lose that. You know, in the back of your mind that it could change and things do
for sure.
change.
Yeah.
Yes. Mm-hmm. Because I know that this has got to be a pretty scary time for you.
Oh, for sure.
Um, mhm. Has there been anything, just for our listeners, is there anything that you do that has been helpful, at least in the little bit for you?
Well, you know, it's like different for everybody, right? Like what helps one person might not really help another. And
Mhm.
I think mostly just like I don't know, nothing like super helps like oh, like this helps so much, but I think maybe just being outside, kind of
Yeah.
like trying to connect. Like I think I've been told this quite a bit. Just like trying to connect with nature, like just trying to be outside,
Mhm.
like just something like not so stressful, you know, to think about.
Mhm.
Just maybe
Mhm.
just like mindfulness, right? Just like
Yeah.
Mhm.
yeah, that's what I would say.
Yeah, I part of my story is, but I had to intentionally connect with everything.
Yeah.
Like, very intentionally, and often big things I had to do in order to feel something big. It
Hmm.
had to be big, for me to do it. So, yeah, and the intentional connection to yourself, Because I would explain it a lot that I felt like my head was disconnected to my body an awful lot, like it wasn't not even the same entity for a long time. I do remember what I was going to say. Shout out to your friends in college for pointing out that you were different and not in a good way.
Yeah.
Yes, because I feel like that's important that people do, if it goes back to if you see something, say something, you could just save someone's life in that way, right?
Yeah.
You could make a big difference for them. So shout out to your friends, even though it probably hurt to hear that.
Yeah.
Yeah, it probably hurt, but they did the right thing by saying something. And if you could rewind time, what do you think you would have done differently?
Just like, that's a good question.
Yeah. What would
Just
you
kind of
say to that
realize,
19-year-old self, right?
yeah, exactly. Like, just that everything will be okay. Like, you don't need to like just be so anxious about everything. Like, just like relax, right? Like work out more. If you're still anxious, go work out more. Go be out in nature. Go connect with things. Like I just I wish I could go back and just not take any medication, but it's too late, right? So if I could
Yep.
tell myself, I would just calm down, like you know, like everything will be okay,
Yeah.
right?
I think
Yeah.
that's the reminder, and I tell my kids this, and I tell anybody who will listen that things will work out.
Yeah.
Everything will be okay if you allow it to be okay.
Hmm.
Sometimes when we interject an intervention, we make it not okay
Yeah. Make it
anymore.
worse.
We
Yeah.
make it worse. Exactly. So, all right. Do you have any other thoughts that you would like to share with anyone about PSSD or your life? What would you like to share?
Um. Yeah, that's a good question. Just that. Like, I wish other health organizations around the world recognize this condition, like the EMA, Health Canada, like the health agency in Canada, Hong Kong, like all over the globe, like they recognize it. But
Yes, they
it's
do.
just, I wish the FDA like would take more action to warn people. Is what I would wish, because I I wouldn't want anybody else to get this. It's just has a life altering effect. Because like, what if this doesn't get better? What if this is my life? For the rest of my life, right?
Yeah.
So it's just they need to be warned before they take medication. Like if you need medication, like I'm not completely against medication, but you need to have like consent of what to expect, and the
Yep.
risks, right? So,
Yeah.
Yeah, and therapists need to keep their mouth shut if they don't understand a medication,
yeah,
and they need to not say false things to people
Mhm.
about medication. They need to just say, "I don't know."
yeah,
I'd rather hear "I don't know" than "absolutely not." Right?
yeah,
I'd rather hear that. So therapists need to get real with this. And as far as the FDA goes and labeling, they need to not bury it on page 13 of
Yeah.
25 on an insert, just so everyone knows
Yep.
that that should be number one, because I think taking away someone's sexuality or ability to connect and pleasure is taking away their humanity. And that
yeah,
needs to be number one. Because this, I thought mental health was regaining humanity and
yeah.
connection. I thought that's what it was, but instead, often it's quite the opposite. So,
Hmm.
all right. Well,
Well,
thank you for being here, Kale.
yeah,
Yeah, thank you guys. I
thanks for
appreciate
coming.
it.
If you
Yeah.
Yes.
guys have stayed this long, we are wrapping up our episode of the Gaslit Truth Podcast. You can find us anywhere that you listen to podcasts, and please go ahead and give us 5 stars because that's what we deserve and that's all we want. And you can also send us your Gaslit Truth stories, or if you're interested in coming on the show, to the Gaslit Truth Podcast at gmail.com. And we are also on all the socials, so you can DM us on any of those as well. So that is a wrap. Thank you again, Cael, for sharing
Yeah.
your story.
Thank you guys. Appreciate it.